Bernard Kruger, or Dr. Bernard Kruger. I'm in my 60s, physician in New York in internal medicine.
What's your specialty, Bernard?
I'm actually an oncologist, but I'm doing primarily internal medicine.
Okay, Bernard, can you list some of the main issues? I mean, people are saying now that 50 is the new 30. In terms of health, your smile tells me, in terms of health, would you say that 50 is the new 30?
I don't know what the old 30 was. I think 50 is 50, but we've got a much longer way to go than we used to.
Is that because of advancements in medicine or because people get tested? Why is 50 now not, let's say, as sickly maybe as 50 was a long time ago?
Well, I think it's some advancements in medicine, some advancements in nutrition, some advancements in lifestyle, and just taking better care of ourselves.
But you do see dastardly things happening to people as they approach 50 sometimes.
I think, yeah, but also as they approach 60 and 70 and 40 sometimes.
What would be the biggest concerns for people at 50?
I think certainly for men, I think they've got to pay attention to prostate, cholesterol, and coronary artery issues. For women, I think they always have to be on the lookout for breast and ovarian cancer, and I think now they've got to be on the lookout more for heart disease.
Heart disease is a big thing. I mean, I'm doing a lot of promotion for that for the Heart Month and just in general. What I've heard and when I talk to other women is most women don't even see a cardiologist. Is that true?
Well, I'm not sure you need to see a cardiologist. I think if you have a thorough internist, that's really sufficient. You ought to know what your cholesterol is. You ought to have a baseline examination of your heart and go from those, those findings.
What do you think of the CT scan for the heart? Do you think that's
I think it depends on what your cholesterol is. I think we have two kinds of coronary arteries, either Teflon or Velcro, and I think the only way to really find out is to do some of these newer imaging studies.
So you can actually have low cholesterol, but if it sticks to your arteries, because sometimes you'll hear the story like so-and-so just dropped out of a heart attack and his cholesterol was 150.
Well, there's a bell curve. Obviously, the lower the better, but there are people in the low range that the cholesterol sticks to their arteries. That's an oversimplification of what happens. There's probably an inflammatory factor in the arteries, and those people whose arteries are inflamed tend to have more cholesterol sticking to their arteries.
Now, this is always the question I ask you because I'm paranoid. Do you see more cancer in people over 50?
Yes.
And does it go up as the years go up?
Yeah, certainly, because some of them are slow-growing cancers like prostate cancer, and we do see more cancer in the older age group.
So if you can just give the people out there 4 bits, because you're a wonderful doctor, and Bernard's a wonderful doctor, 4 bits of, no, he has been my doctor forever, and I've driven him totally crazy at times, 4 bits of wisdom or just advice. I mean, the 4 things a year, everyone, we know we should eat properly, we know we should exercise, lose weight if we're fat. I heard a statistic this morning, 2/3 of America is obese or overweight.
I just got back from Disney World.
That's where
I would say the statistics are higher. Anyway.
What should people do? Every year, what should people check and what should people keep up on every year?
I think the most important thing you can do is pay attention to your body. If there are changes that persist for any period of time, go find out what they mean. In other words, if you have an isolated pain in your shoulder or your hip or your back and it doesn't seem to go away, it doesn't get worse necessarily with exercise, and you can't relate it to trauma, go check it out. If you have a change in your bowel habits, go check it out. If you have persistent headaches or cough, go check it out. And in addition to paying attention to differences, to issues that come up, I think regular physical examinations are useful, especially over 50. I think you ought to have your cholesterol checked. I think you ought to have regular colonoscopies. I think women should have mammograms and ultrasounds
Every year?
every year. And I think bone densities are important every couple of years. I think you get your baseline and you do your exams somewhat based on your baseline. But I think most importantly, pay attention to what's going on. Don't deny things that are bothering you, and go have them checked out.
Well, thank you very much. And I'll probably come in and see you next week, get some blood work just for the hell of it.